Hello, my name is Jensen. I'm an environmental health specialist for the Arkansas Department of Health. Today I'll be presenting the topic of pharmaceutical waste in the water supply. So pharmaceutical waste in the water supply, what we will be discussing, this is a brief outline. So we will be discussing causation of how medications can enter our water systems, such as through improper disposal, animal excretion, and excess drug supply. We will also be looking at why this is important to us as a community. So we'll be examining community health concerns as well as environmental health concerns. And then lastly, we'll be reviewing prevention measures to help limit this issue in the future through community education and also discussing disposal site access. So a study conducted by the U.S. Geological Survey in 1999 and 2000 found measurable amounts of one or more medications in 80% of the water samples drawn from a network of 139 streams in 30 states, as cited by the Harvard Health Letter. And so this just shows how widespread this concern can be and why it's important that we take a look at the causation of this. So first we will look at improper disposal. So improper disposal can be when patients or family members of that patient throw medications away that either in the trash bin, or a more direct method of it entering the water supply is when the medication is flushed down the toilet. Oftentimes a family member or patient may feel like putting a medication down a drain or a toilet is the best way to keep it safe, or their family members safe from accidentally consuming this, especially if there's young children around. And so that isn't a method people will see as an immediate way to dispose of a medication, but unfortunately that introduces it to the water system, which can have adverse effects, which we'll get to later on in this presentation. So trash bins also are not the best method. They are typically considered better than drainage systems, just because trash is often incinerated or disposed of that way in a landfill, so it won't be easily entering the water system. Now according to the FDA, there are certain medications that are high risk or have a high potential for danger, especially if like a child was to get hold of them. For example, a lot of narcotics are on a list stated by the FDA that says if not to be used, should be flushed immediately down a drain or toilet to avoid access to those medications. And that is just a safety concern. But so overall though, if a medication is not on that FDA approved list, you should not flush medications down the toilet or through the drainage system. Another method of medications entering the water system is through animal excretion, such as like farms where they use antibiotics and hormones in their cattle or chickens to prevent them from getting a disease and also being able to grow properly in those conditions. So these farms, those animals exposed to those medications, their waste products can run off into the water system and may not be broken down or filtered through the current sewage programs that we have, resulting in their accumulation in the water supply. And another part of this, which also applies to human, is the difficulty in metabolizing or breaking down medications. There are often medications that certain individuals may not be able to break down or metabolize in their body, and so when they're excreted, the active forms of those medications are entering the water system as well. And the last causation that we are looking at is the excess drug supply and prescribing. So we see this in pharmaceutical companies and also with doctors' offices and nursing homes and hospitals. So with pharmaceutical companies, there's a large demand for medications and they will make a large amount, but these companies also, through the process of creating these medications, can have pharmaceutical runoff from their plant locations, which can enter the water supply, as well as overprescribing of different medications, particularly antibiotics, is another concern. since those medications go unused, thus get thrown away, and if thrown away improperly, can enter the ecosystem. Hospitals and especially nursing homes are another area of concern because hospitals tend to have a method in place for drug disposal, but with nursing homes, depending on their individual independent systems, they may not have a method of disposal, so this often results in a patient who had passed away, their leftover medications being flushed down the drain or down the toilet for more immediate disposal. So now we will be examining community health concerns. So how can this impact the health of my community? Well, in one study by Dr. Nassiri and Dr. Abdali of the Daru Journal of Faculty Pharmacy, they found trace amounts of a variety of different medications in the water systems. And this ranges anywhere from birth control, which contains estrogens, to pain medications that can be anywhere from over-the-counter medications like ibuprofen to prescription strength pain medications, antibiotics, diabetes medications, and antidepressants. There's also many other medications that were on this list as well. And so what is the concern about these medications being in the water system? Well, unfortunately, there's no defined data as of yet of adverse effects of these medications in humans. There is a concern for allergic exposure for those individuals that are allergic to these particular medications who will be more susceptible to adverse effects or poor reactions if exposed, especially in accumulated amounts. There is one other area of concern to the community, which is the development of antibiotic-resistant organisms. So according to the Arkansas Department of Health, Arkansas is the 6th highest state for antibiotic prescribing as of 2014. And this overprescribing can often result in those antibiotics entering the water system, and those unused antibiotics being exposed to the environment, also in other humans, provides organisms the opportunity to develop a resistance to those antibiotics. And organisms can spread their resistant strains amongst each other, and this can result in a more rapid increase in this antibiotic resistance, which can be a serious health concern for more serious infections, especially in patients and family members with poor immune systems. So if you have young children or also like aging parents, like the elderly and young children both may have weakened immune systems and might have to rely on antibiotics larger than an average healthy adult. And so these patients will be at an increased risk of infection, but then if there is higher antibiotic resistant organisms in their community due to antibiotics being in the water, then this could result in the antibiotics failing and treating the infection fully, causing further health complications. So now we will be looking at environmental concerns. So unlike with humans, where there's limited data available about adverse effects directly connected with water or pharmaceuticals in the water system, there have been various research topics covering and showing that there is a direct impact on the environment, especially on aquatic life, due to medications being in the water system. So one such situation is the disruption of animal development, which an example of that is the excess feminization of fish and also of amphibians. So this is resulting in an offset ratio of more females to males, and the fish in these rivers that have high levels of birth control or that contains estrogens or like contraceptive pills, causing more female fish to be present than male. And unfortunately, combined with other environmental factors, this has caused a decline in certain minnow populations. And another area in which the aquatic life is affected by the same concern of hormone disruption is in amphibians, where in certain areas where there's an excessive amount of estrogen in the water, frogs will be intersexual, so they will have both male and female characteristics. And these are both two direct results of these medications being in the water system. And another situation is how the entry into the ecosystem, so not just the aquatic life, but also how this can spread to other animals that consume those plants or fish or that water and then are consumed by other animals and how they can be affected. So one such example was explored by Sonia Shah of Yale University in her article in regards to the gyps vultures in India and Pakistan. So what happened was there was farmers in India and Pakistan that had their cattle on diclofenac, which is a strong arthritic medication. And they were doing this so the animals would be able to produce more milk and be more efficient in their work. But when those cattle passed away, they were taken to a certain location to be disposed of, where they were basically brought there to be eaten by the vultures, which ideally was a efficient method of disposal. But because these cattle were exposed to these medications and had them accumulated in their body, when the vultures ate the carcasses of the cattle, they were also exposed to the diclofenac, resulting in actually the vultures not being able to process the medication and a disruption in their population. So and this resulted in, as of today, a 95% decline in the gyps vulture population in India due to direct exposure of this medication. So now that we've looked at community health concerns and environmental health concerns, we will look at prevention measures. So we now understand why it's important to take measures to prevent these medications from entering the water system, whether it be to limit antibiotic resistant opportunities and to protect those who are possibly allergic to these medications, but also to protect our environment and the aquatic life and animals that rely on that water. And so some prevention measures are community education, so just discussing methods of disposal, learning about drug take-back programs through your local police department, where they host yearly events where they will have lock boxes available for people to come and drop off their medications. There's no need to provide your name or identification. They don't want to dissuade anyone from dropping off any old medications. They just want to be able to dispose of them properly. And also, if you go to the Arkansas Drug Take Back website, which I will have in the citation link, they will have disposal site access that you can look up based off zip code. So these are drug drop boxes that are secure, and they're where people can drop off their medications and they will be taken to a proper disposal site. So this is the best method of disposal available to the public. And unfortunately, since Arkansas is rather rural, if you live in a more rural area, especially southern Arkansas, you may not have access to these drug drop boxes. And that is when you would have to still rely on using a trash bin or waiting for drug take-back programs in your local area, which again you can look up on the Take Back Arkansas Drug website. And so by doing all this, you can help limit the exposure of these medications to our water system, preventing the development of antibiotic-resistant organisms, and also protecting our ecosystem. And another method of prevention is that the EPA is actually stepping in and increased monitoring of the water system. They have added 10 pharmaceutical compounds to the EPA watch list. So now in summary, so we discussed causation, and that can range anywhere from domestic wastewater, such as shown in this diagram, agriculture effluents, such as from animals, and then also industrial wastewater, such as from pharmaceutical companies, hospital sewage, whether that be a hospital or also including nursing homes, and why we discussed why as a community we should be concerned, since this can affect both our elders and our children through antibiotic resistant organisms developing, and also the exposure of these unprescribed medications to those with allergies could be a potential risk. And there's also a concern with the environmental impact and what this can mean later on for other animals exposed to these accumulating drug products. And then we discussed prevention measures, such as not to flush medications down the toilet unless they're on the FDA approved list, and participating in drug take-back days, and using the Arkansas Drug Take-Back website to locate disposal sites. Then lastly, these are my citations. So the first citation is for the Arkansas Take-Back website. So please feel free to follow that link to find the disposal access points near you. You just have to type in your zip code and they should be brought up on a map. And then if you have any questions for me, feel free to ask through email or reach out to me later after this presentation. Thank you.